Finding treatments for primary progressive as well as non-relapsing forms of secondary progressive MS has been challenging. The treatments for the most common form of the disease, relapsing remitting MS, and for secondary progressive MS with relapses haven't turned out to be helpful. Treatments for relapsing remitting MS reduce inflammation and immune attacks, but there is less evidence of ongoing inflammation and immune attacks in primary progressive and non-relapsing forms of secondary progressive MS. Those two forms of progressive MS are characterized by a steady worsening of neurologic function. The rate of progression may vary, but it's continuous, and it's tied to degeneration of the nerves. In progressive MS, the nerve degeneration isn't related to waves of immune attacks from outside the central nervous system. Instead, the immune troublemakers seem to have taken up residence inside the CNS where they cause the damage. We're working on understanding how these troublemakers infiltrate the CNS and how to block this from happening. Recent research suggests that a fraction of people with primary progressive MS share some underlying biology with people who have relapsing remitting MS. So in theory, that makes them candidates for the medications that we do have today. But so far, there's not an established way to determine who might benefit. Research and clinical trials to treat progressive forms of MS are ongoing. A phase 2 study of a high-dose statin, the drugs used to lower cholesterol, did find that over 2 years, the treatments reduced brain atrophy, or shrinkage, by 43%. And that's promising news. But the jury is still out on this drug because we don't know if the effects will persist, whether the drug is safe if taken for longer periods of time, and who will be the best candidates for the treatment.